and to ensure health care for every citizen in the state.
Okay. When you talk about health care, and I don't think I've mentioned that in my opening remarks, I don't think there's any disputing that it is one of the main concerns for people, not just in Wisconsin, but in our nation. And when we talk about health care reform, there's really two issues that you need to talk about. One is access and one is affordability. Access, Wisconsin probably leads the nation in access to health care services. Less than 2% of our state does not have access to some type of health care plan, and all children in our state are already covered or already have health care services available to them. So Wisconsin leads the nation in providing access to health care for their citizens. The bigger issue is, of course, affordability. Wisconsin also is near the top on having some of the most expensive healthcare premiums in the nation, and that's not a good place to be. It's affordability, and as I talked about in my opening remarks, to bring down cost, the only way you bring down the cost of a service is to let the consumer have greater choice and control. And the way you do that is through transparency of cost. In other words, so consumers can know before they buy the healthcare service what it's going to cost. Many of you, myself included, don't have any control over choices in your healthcare service. Your insurance company makes all the decisions for you. They tell you where you're going to go, they tell you what doctor you're going to see, or what clinic you're going to go to. Just one last comment I want to talk about, and which I did also address in the opening remarks, is the concept of universal government-run health care. It is projected to be a $15 billion expense. If we would go to that, it would be the largest tax increase in the history of the United States. And I have never said that my opponent supported healthy Wisconsin, but he has said that he thinks universal health care is the way we ought to be going, and we're going down the right road by doing it. So I guess I would take exception with that. I think that we need to work on getting the consumer in control instead.
Kim Hixson.
Thank you. My opponent mentioned the 2% of Wisconsinites that do not have any sort of access, and by my mathematical skills, which are sometimes questionable, that's about 116,000 people, and yet in our state we have almost 500,000 people who do not have insurance coverage. So while coverage is available out there, it's so expensive that a lot of people can't afford it. They can't afford it. It costs, on average now, $12,000 a year for family insurance coverage. I met a woman just the other day, works here in Whitewater, and she has insurance coverage that she got with her company when she came there about 15 years ago. And at the time, her company paid the full price for the coverage. And she had, I believe she said, a $1,000 deductible. And she had to do co-pays and all that. Well, her company still pays the full cost of that coverage, but she has an $11,000 deductible. That's $11,000 she has to pay every year before her insurance kicks in. So yeah, you know, we've got to work to find an answer to this healthcare mess. We got to do it in a fiscally responsible way. But what we got to do as a state and as a government is talk about it seriously. And we haven't done that so far. As far as I'm concerned, we now have choice and control. And I voted for a bill that said we could have transparent coverage. I didn't think it would hurt, but I really don't think it's going to help much.
Rebuttal, Debbie?
Yeah, I guess I just want to say the concept of having the government take over and pay for health care for everybody makes it sound like that'd be great because I won't have to pay anything, but once again, I just want to reiterate to you that you are the government. And this group right here, those of you who are getting an education and are going to be some of the higher wage earners in our state, hopefully if you stay in the state, you're going to be paying the biggest amount for government health care. It's estimated that it would be an additional 15% state deduction on everyone who works paycheck every month. So even if you are an average, in the average area, which is around 30,000 for Wisconsin, you'd be paying over $500 a month, and it wouldn't be just you, it'd be you and your wife or you and your husband. Everybody who works would be paying that kind of a deduction to cover the cost of health care for everyone in this. So it's not like it's free, or that it won't be free to you, and you're the group that's probably going to pay the very heaviest for it. Excuse me. And so I just, things that sound too good to be true are too good to be true sometimes. And for $15 billion, which is what it would total, I agree that we need to do something for the 110,000 people or so in Wisconsin that cannot access insurance right now. But I think we could give them very good insurance for a lot less than $15 billion a year. And so I don't disagree that it's an issue we need to talk about, but government-run universal health care is not the way to do it. Rebuttal?
You know, out knocking on doors this summer, I was over in Edgerton and knocked on a door, and an elderly gentleman came to the door. He's 78 years old, and talked to him for a while. He was cleaning out his house. He was selling his home. And he told me that his wife had cancer. She battled it for 4 or 5 years. She'd lost that battle. She passed away about a year before. He had insurance, but the insurance wasn't good enough. And to pay those hospital bills, he was selling his home. He had no children, had really no other family. And I said, "Where are you going? Where are you going?" And he said, "I don't know." This is America, folks. We're the richest country on earth. That shouldn't happen in our America.